Next comes after the stage of spinal shock is called as stage of reflex activity. So if the condition is that if the patient's or subject's general health condition is fine, everything is fine, he's on a path of recovery, he's on the road of recovery, there will come a stage of reflex activity. And it also is known as a stage of recovery. What is happening here is there may be that smooth muscles will regain their functional activity. So first of all, we'll see that the urinary bladder becomes automatic. There is a reflex evacuation. So when there is distension because of the flow of the urine present in the urinary bladder, this stretching of the urinary bladder will cause the contraction of the urinary bladder muscles. And so because of that contraction, there will be micturition. So this similarly, there will be a presence of reflex defecation also will start. And slowly we'll find that the sympathetic tone of blood vessels is getting regained. Hence, that fluctuations that we were seeing initially is now towards the normal side. So BP might be normalized. One thing I wanted to tell you that in case of spinal shock, since there is loss of sympathetic fibers, there is loss of sympathetic innervations to the sweat glands, so the skin becomes very dry and scaly. We are going towards the recovery. There may be that those innervations to the sweat glands are back to the recovery, and there will be increase in the sweat production, and now the skin is no longer dry and scaly, rather it has become now moist because of sweat glands being active. And what do we find in skeletal muscle tone? In the skeletal muscle tone slowly will recover after 3 to 4 weeks, because first 3 weeks the person is in a stage of spinal shock. Following that, if condition is, again there is an if the general condition is fine, everything is fine, he is towards the stage of recovery, we'll find these changes. There is what we see that in skeletal muscle, the tone of flexor muscles will return first, and therefore the flexors become less hypotonic. See, what we had learned before is when the person goes for a spinal shock is also called as, it is the main characteristic is flaccid paralysis. Now, as you are towards the recovery, there will be some improvement in the tone. So instead of being more tonic or flaccid, there will be a change in the tone of the flexors. So here the flexors are the first one to regain that activity or the tone of the muscles, and then followed by there will be the extensors who are going to regain their tonicity. This here, what do we find? A condition we call as paraplegia in flexion, where both the limbs are in a state of flexion. I am going to tell you what do I mean by paraplegia in flexion or paraplegia in extension. What is still difficult is this person is a spinal man and there will be difficulty for him to support his body. Person, if you make him to stand without any support, there is a high chance that he may fall down. No wasting of muscles is seen. Now, let's go on to understand what do I mean by paraplegia in extension or paraplegia in flexion. What did we see just now? That in the spinal recovery stage, there is paraplegia in flexion. The tone of the flexors, they are the first one to return back, then followed by the extensors. Here, it's a separate slide just to differentiate at what do you mean by extension and what do you mean by flexion. Paraplegia and flexion occurs as the disease or lesion progresses further or with complete transection of the spinal cord. Extrapyramidal tracts get involved in this, and this leads to more hypotonia in the flexor group of muscle, resulting in flexed posture of the limbs. So a person who is in a recovery stage, you will find that his limbs are more flexed. He can flex it faster, earlier. And how about if there is a paraplegia in extension? We find that it occurs in the initial or the partial transection of the spinal cord with the involvement of pyramidal tracts. Here, since the involvement is of the extrapyramidal tracts, we find that the group of flexors, they regain their tone earlier. Here it is the involvement of the pyramidal tracts. So we find that hypertonia, it is regained and it is more in the extensor group of muscles.